Hello, it's Dr. Rhonda Johnson. Today is Thursday, April 13th, 2023, and today I'm discussing preterm birth. Well, April 11th through April 17th has been designated Black Maternal Health Week to raise awareness of the state of Black maternal health here in the United States. So today I'm discussing preterm birth. Well, a preterm birth is when the baby is delivered before the 37th week of pregnancy. Now, every year in the United States, about 1 in 10 babies is born prematurely. Now, premature babies may not be fully developed, and they can sometimes have conditions with health conditions that last through childhood and sometimes a lifetime. Now, Black women in the United States are 50% more likely to have a premature baby, to deliver prematurely, than white women. And we know that preterm birth can lead to infant mortality, which sadly, Black infants in the United States die before their first birthday at more than 2 times the rate of white babies. Now, there is no one single cause why Black women are at higher risk of preterm birth. And it doesn't matter if the mom-to-be has a doctorate or if she has a GED. She can still have the same birth outcome. Now, many Black women birth advocates say the higher rates of premature preterm birth among Black women is due to the many physical, psychological, and social stressors that they experience on a daily basis. So what can be done to help turn things around? Well, first, all moms-to-be need quality, respectful care that honors their choices, preferences, preferred language, culture, religion, and traditions. And it is so important for moms-to-be to have support during and after the pregnancy and during childbirth. Now, the March of Dimes also recommends some steps that women can take to reduce their personal risk of premature birth. Now, these recommendations apply to all moms-to-be, and I want to say that you can do all these things and still have a premature birth. But getting regular prenatal care throughout the pregnancy is extremely important. Maintaining a healthy weight to gain not too much, not too little during your pregnancy in consultation with your obstetrical care provider. It's important not to smoke or drink alcohol, use street drugs, or abuse prescription drugs, because many of these can cross the blood barrier of the placenta and cause growth restriction in the baby and other problems. So it's important also to have treatment if you have chronic health conditions such as high blood pressure, diabetes, depression, any chronic condition. You want to make sure that it's well managed during your pregnancy. It's also important to talk to your doctor about the vaccinations that you may need during your pregnancy. Make sure you're up to date. You want to protect yourself from sexually transmitted infections. It's important also to avoid eating raw meat, fish, or eggs, and to avoid touching cat feces. I talked about having support during the pregnancy, but if you can practice self-care, such as staying connected to friends, families, loved ones, get enough sleep, be active during your pregnancy, and enjoy your pregnancy, that helps as well. So again, very general recommendations, but again, my point is to bring awareness to preterm birth as part of Black Maternal Health Week 2023. As always, seek medical advice from your healthcare provider. This information is just general in scope. Take care, folks, as always, and be well.